Hello and thank you MedEcs for the opportunity to share some commentary on our recently published paper in JACC Interventions, the impact of aortic angulation on contemporary TAVR outcomes. As we know, an aortic angulation greater than 48 degrees had previously been shown to adversely influence outcomes in early generation TAVR. However, data on contemporary valves had been lacking. And so we performed a retrospective observational study of over 800 patients at our institution who underwent transfemoral TAVR between 2015 and 2020, either receiving the SAPIEN 3 or the core valve Evolut Pro. Our primary outcome of interest was procedural success. In addition to this, we looked at inpatient mortality, stroke, greater than mild PVL, and permanent pacemaker implantation. As part of our secondary analysis, we sought to determine if there was a new cutoff using contemporary valves. And we did find that aortic angulation greater than 48 degrees no longer played a role in procedural success rates in both the balloon expandable and self-expandable newer valves. In addition, other outcomes such as in-hospital mortality, stroke, permanent pacemaker implantation, and greater than mild PVL did not differ above or below 48 degrees using either TAVR platform. In our secondary analysis, we used an ROC analysis to try to pinpoint a new cutoff of aortic angulation to determine procedural success, and we found that there was no new cutoff, and that aortic angulation no longer plays a role with newer generation transcatheter heart valves in a contemporary TAVR practice. So in conclusion, an aortic angulation greater than 48 degrees no longer affects procedural success or in-hospital outcomes, and should no longer be a consideration when determining valve selection in a contemporary TAVR practice. Thank you.